BC has released its latest data on deaths from illicit drugs for the last year. It shows on average more than 6 people died from an overdose every day in 2022 in the province. Last year, there were close to 2,300 deaths attributed to suspected illicit drug toxicity, making it the second deadliest year on record. Of the deaths last year, most of the victims were between 30 to 59 years old. Almost 80% were men. The highest number of deaths were in Vancouver, Surrey, and Greater Victoria. The CBC's Susanna De Silva is tracking all of this for us from Vancouver. So, Susie, what more did we learn in this latest report?
Well, the report further breaks down those staggering numbers. It shows it is a problem that is all across this province. And what we heard from that press conference from the chief coroner was frustration that she was here again years after this was declared as a public health emergency, detailing staggering numbers of deaths across the province. As you mentioned there, the majority are men, 30 to 59. They also talked about the profile of those who are dying. And while many people will think that there are people on the downtown east side, maybe people who are experiencing homelessness, she says that doesn't fit the profile. These are people who may have jobs, people, their families, friends, may not know that they are using substances, and they are the ones who are still dying inside private homes. They are again encouraging people to use together, to let other people know, which is part of why they say reducing that stigma is so vital in this situation. We know that 3 of 5 health authorities in this province received the highest number of overdoses last year, so it is a problem across the province that they are seeing. 11,000 people have died since this was declared a public health emergency. They also talked about those who are not reflected in this report. And that is 10 times as many people die from overdose, but there are 10 times as many who experience an overdose but don't die, who then have lingering lifelong consequences before it. They also spoke about First Nations. They are disproportionately affected by overdoses, 5 times as likely to die as other residents of BC, and experts say more needs to be done there.
This has left empty spaces in families, homes, workplaces, and ceremonial and cultural places. So many years of lives lost. In about 3 years, we have changed the course of a global pandemic to the point where many of us are living some semblance of our lives in normalcy pre-pandemic. And yet the toxic drug crisis continues unabated.
So, Susie, what do health officials say needs to be done?
Well, I say it's a number of things that have to happen. It has to be a multi-pronged approach. The coroner was grateful to see decriminalization that took effect today, but she's also been critical that the threshold is too low. She says safe supply needs to happen to really be making a difference. The other issue is treatment. It is unregulated in this province. She says it is difficult to keep track of, and it can take, we heard from an addiction specialist, it can take weeks, 2 or 3 weeks just to get into detox, and perhaps months to get into another facility, and he expressed his frustration.
We are failing, and I don't point to any individual government, but at the level of the federal government, provincial government, municipalities, me, myself, and my colleagues, at every level, I hope to see that level of urgency, that level of outrage driving change, and we're just not seeing that from anyone. So collectively, as a society, I would say we still have not decided to address this as the emergency that it clearly is.
Now, we heard from the provincial minister responsible, who says that they do understand the urgency, that they are working to it. Take a listen to what she had to say.
The causes of this crisis are more complex. And so what our government has done, what Premier Eby has done, is brought together mental health and addictions with housing, with health, with the Solicitor General to work together on all of the elements that we need to address in order to keep people safe and keep communities safe.
Now, she says they are working on this whole continuum of care. They are promising more money, more efforts, but many experts say it's simply not coming fast enough.
All right, Susie, thank you. The CBC's Susanna De Silva live in Vancouver.